Now, even if you do get tested, the threat of false negatives is more real than you might realize. A recent study shows mass testing could give hundreds of people false hope as the spread of COVID-19 continues.
Rachel Carden continues our live team coverage tonight. She spoke to a professor at Johns Hopkins School of Public Health about all of this.
That's right, Nicole and Vic. Now, obviously, the concern is that people who are sick are testing negative and possibly spreading the coronavirus without even knowing it. If you think you have COVID-19, you'll likely be given a nasal pharyngeal swab. But if it comes back negative, a new study shows it's possible you're not in the clear.
You might test negative just because you've just been infected and there's only a little tiny bit of virus in you and hasn't had a chance to replicate enough for that swab to get the virus out.
The study by Johns Hopkins shows the chance of a false negative test is about 1 in 5, sometimes higher. Associate Professor Justin Lesser tells WJZ at the time you start showing symptoms is when you're most infectious. If you got tested the week before your symptoms started, you still had the virus and you're likely spreading the disease within your family and friend group once symptoms appear.
If people get overconfident based on a negative test, if you have concerning symptoms and get a negative test and then don't go to the doctor, then I think it's a problem.
Here's the silver lining. If you test negative when you do have traces of coronavirus in your system and then show no symptoms, you might be less dangerous to those around you.
We don't know for sure, but it's likely when you test negative, you're less likely to transmit.
Because so little is known about coronavirus, how it's contracted and who is infected, researchers say mass testing is still the right move.
The test is still extremely useful, and it is probably our best tool besides all staying in our houses.
Now, of course, researchers say some of this comes down to common sense. If you live with someone and they have the coronavirus and you don't have any symptoms, you go get tested and it comes back negative, but then later you develop symptoms, it's likely that you just didn't have as much of the virus in your system yet, and it's best to get tested again. Reporting live tonight, I'm Rachel Carden for WJZ.